Acute abdomen. Acute abdomen is defined as abrupt onset of abdominal pain with duration less than 24 hours. Life-threatening causes of acute abdomen: ruptured abdominal aortic aneurysm, aortic dissection, myocardial infarction, bowel perforation, mechanical bowel obstruction, acute mesenteric ischemia, acute pancreatitis, acute cholangitis, ruptured ectopic pregnancy. Ruptured abdominal aortic aneurysm. History will be consisting of age greater than 50, smoking history, abdominal or back pain, pulsatile abdominal mass, rapid bedside testing, ultrasound abdomen or pelvis. Finding will be dilated aorta. This is abdominal aortic aneurysm. Diameter of abdominal aorta less than 3 cm rules out abdominal aortic aneurysm. Aortic dissection, acute tearing, chest or back pain, radioradial or radiofemoral delay, rapid bedside testing. On chest X-ray, finding will be widened mediastinum. Advanced testing consists of transesophageal echocardiography and CT angiography. Myocardial infarction, epigastric or anginal pain, coronary artery disease, risk factors, rapid bedside testing, ECG changes, ischemic ECG changes, ST elevation myocardial infarction, non-ST elevation myocardial infarction, cardiac biomarkers, CKMB, troponin I, these are elevated. Bowel perforation, peritoneal signs, that is rigidity. Rigidity is contraction of abdominal muscles. Patient cannot relax his abdomen on his own. Guarding is of two types, voluntary and involuntary. Voluntary guarding is stiffening of abdomen, anticipatory to physical exam. Involuntary guarding is stiffening of abdomen on palpation. Rebound tenderness, deeply palpate the abdomen for 5 seconds and then abruptly withdraw the hand. There will be more pain experienced by the patient on withdrawal. Diffuse abdominal pain, rapid bedside testing. Rapid bedside testing for bowel perforation or abdominal X-ray and chest X-ray. There will be air under diaphragm. Here is air under diaphragm. Air under diaphragm. Bowel obstruction, colicky pain, gross abdominal distension, tinkling or absent bowel sounds. Tinkling sound is produced when air or fluid tries to pass through the partially occluded lumen. Rapid bedside testing, abdominal X-ray, dilated bowel loops, air fluid levels. Here are dilated bowel loops. These are air fluid levels, black air, white fluid. Acute mesenteric ischemia, diffuse pain out of proportion to exam. Patient will be experiencing more severe pain than physical signs. Embolic risk factors, for example, atrial fibrillation, gives clue to the diagnosis of acute mesenteric ischemia. Rapid bedside testing, elevated lactate. Serum lactate will be elevated due to hypoxia. Advanced testing for acute mesenteric ischemia is CT angiography. Acute pancreatitis, epigastric pain radiating to back, nausea, vomiting. Risk factors for acute pancreatitis, rapid bedside testing, elevated lipase 3 times upper limit of normal. Acute cholangitis, right upper quadrant pain, fever, jaundice, hypotension, altered mental status. Rapid bedside testing, LFTs, ultrasound, LFTs, ALP, GGT, bilirubin, ALT, AST. ALP and gamma glutamyl transferase are more raised in surgical jaundice than in medical jaundice. There is no or minor change in ALP or GGT in medical jaundice. Ultrasound gallstones, dilated bile duct, thickened bile duct. Here is a gallstone. Here is posterior acoustic shadow. This is CBD, dilated bile duct, ruptured ectopic pregnancy, unilateral lower abdominal pain, vaginal bleeding, amenorrhea, rapid bedside testing, beta HCG more than 1500. On ultrasound, there will be no intrauterine sac. Acute abdomen, a life-threatening diagnosis of acute abdomen. Acute mesenteric ischemia, acute pancreatitis, acute cholangitis, abdominal aortic aneurysm, aortic dissection, bowel perforation, bowel obstruction, ruptured ectopic pregnancy, acute coronary syndrome. Thank you.